Hello, everybody. I'm Andrew Malley. I'm the CEO of Dignity Health Global Education, a workforce development company in the healthcare field. Today, we have a great webinar. We're going to be talking about wellness and retention in the nursing workforce, a really, really hot topic at the moment. I'm joined by some great people here. I'm talking to two titans in their respective fields. First, I have Dr. Kathy Sanford, a national nursing leader and a chief nursing officer of Common Spirit Health, the largest not-for-profit health system in the country. We also have Arianna Huffington, a giant of corporate America and CEO of rapidly growing Thrive Global, which is a global leader in wellness and a platform for industry to help their workforce. Both of you, thank you so much for joining us today. And I'm going to get straight into it. This is a meaty subject. This is a big area. And I'm going to start with you, Kathy. We're told that we should practice wellness and how important that is, and it undoubtedly is so. But what are the challenges in doing this in nursing? What makes nursing such a unique field that, you know, to practice these wellness techniques can be a challenge?
Well, wellness, of course, is important for everyone. But right now, I think you've seen in the media quite a bit about what's happening with the nursing profession. But I always have to tell people when I'm talking about wellness and nursing, I need to tell them that this is not a new thing. This has been an issue for nurses for a long, long time. People who go into a profession like nursing where they're caring for other people often end up spending so much of themselves and so much of their energy and so much of their love on other people that they sometimes forget to take care of themselves. And so in nursing, we have had wellness problems for many, many years. We have, it's over 50% of nurses have weight problems. We have sleep problems. We have stress problems and issues just because it's such a difficult job. And when you add to that what's been happening recently in the world and COVID, it makes it even more obvious that we need to figure out a way to help people like nurses take care of themselves and to be well, and to help them not just take care of themselves, but to have systems and supporters and managers, et cetera, to help them with that. We've looked at wellness for patients and for communities for a long time, but we haven't always talked about wellness of ourselves, right? I actually wrote a newspaper column in the 90s called Living Well, and it was all about telling people in my newspaper column about how important it was to stay well. And it's important to get care when you're sick, but it's also important to stay well. And then one day I realized that I was talking just to the people that become our patients in our communities. And I needed to do something about the people who are actually doing the care. So many years ago, I also started writing, doing a little bit for Sigma Theta Tau, which is a nursing honorary group that has online classes. And I started teaching classes for nurses about managing their stress and managing their lives and staying well, and how it's just as important to take care of yourself. You can't give from an empty basket. And if you cannot take care of yourself, you cannot give the love and the kindness and the caring that everybody else needs. So I was a little bit, some of my nurse exec friends said, you know, some of the stuff you're saying is right, but Kathy, and some of the things I said was, when we call you to come in on an extra shift, if you are able to do that, and you can come and you want to come, that's okay. But if you don't, and you need that time off, and you need to rest, and you need to be with your family, and you need to balance your life, don't let anyone guilt you into doing something that's not going to be good for your own wellness and your own health. So I just have to remind people, this is not new. People have not taken good care of themselves for many, many years, and nurses are masters at that, at caring for everybody else and forgetting to care for ourselves. So it's absolutely important. And I know, Andrew, I think we'll talk some today, if we have time, about some of the things we can do to help nurses do that. But that's why it's so important. Thank you.
Yeah. So Arianna, this is obviously a really high demand, high pressure role, that nurses have. And you've spoken a bit about this before in your idea of first mile, of people looking after themselves in the beginning rather than at the end. And so as you listen to Kathy speak, what do you think are some of the kind of practices and ideas that the nursing workforce could implement to sort of improve their wellness and do some of the things Kathy's mentioning?
Well, first of all, I think Kathy is so right. And she was ahead of the curve, writing that column so many years ago. That was really pioneering, because I believe what has happened is that COVID has accelerated our understanding of what Kathy is talking about, and has brought the problems with nurses taking care of themselves to the forefront, even among people who are not in the nursing profession. And Thrive started, for example, a partnership with Harvard School of Public Health and CAA that we call First Responders First. And the idea is that you have to take care of the first responders. And in this case, it's the nurses before you can take care of anyone else. Because as Kathy said, it's very hard to give of your overflow, to really give and be present when you're exhausted and depleted. So I think modern science has helped us understand that nurses taking care of themselves is not self-indulgent. It's kind of foundational. And that's really the big shift now. It's not a nice thing to do. It's an essential thing to do. And at Thrive, as you know, because we're working together on this, we've broken down new habits into micro steps, tiny incremental daily steps that improve health and lead to healthier habits, so that it doesn't seem overwhelming. And Kathy mentioned sleep. Sleep is foundational. A lot of people now begin to understand the science of sleep and how important it is, but they have a hard time sleeping. So we have brought in these 60-second micro steps during the day to reduce stress, and therefore release the cortisol hormone from the body, move us from the sympathetic to the parasympathetic nervous system. And that's all based on modern neuroscience, so that we don't end up the day marinated in stress. And if you're a nurse, that's more likely than if you have a less demanding job. And if you end the day marinated in stress, it's much harder to unwind and fall asleep and recharge and start the day recharged. So we have these micro steps, the 60-second resets during the day. And for example, we can preload a nurse's phone with these resets. So in between acts, or even just while walking to the next job, they can play a 60-second reset to remind them to focus on their breathing, or remember what they're grateful for in their lives, which is an antidote to stress, or to simply stretch and therefore bring some more oxygen into their bodies. And, we talk about breathing as a superpower. Many people may think, oh, breathing, it sounds sort of warm and fuzzy. But, Navy SEALs use something called box breathing to relieve stress in extremely stressful situations. Inhale to the count of 4, pause to the count of 4, exhale to the count of 4. So reminding nurses and that they have these tiny micro steps available to help themselves during a stressful day, and therefore not end the day as depleted as so many of them really do. And then, as Kathy said, being willing to say no when they're so exhausted that it's going to be of real detriment to their own health.
Absolutely. Kathy, what's interesting here, I think, is the idea that the knock-on effect of this. So, as Arianna said, this shouldn't be peripheral. this should be foundational. And as a sort of, national leader, a veteran of the industry, what is the knock-on effect? So if so people can understand, if nurses and more so obviously employers support nurses in that foundational step, that wellness, such as Arianna described, what do you think are the knock-on effects of that in healthcare, both from a nurse's point of view, but also perhaps even from a patient's point of view?
Well, I'm going to start again with, of course, you can't give from an empty basket. I said that already. But when we talk about all of the things that affect nurses' health, the effects have names. We talk about burnout. We talk about compassion fatigue. We talk about being depressed. We talk about health issues, and all of those things affect everything else. They affect whether or not you want to come to work. They affect whether or not we're going to have enough staff. They affect whether or not you're going to get joy at work, and how you deal with your family at home because of what's been happening at work. They affect, frankly, the whole world. I'm a bit of a nurse advocate, you may have picked up on, and I think as nursing goes the world, right? Nurses are so important and have so much to do with the health of others and the health of their companies and the health of their communities, that people who may not have ever seen a nurse, although you all will one day, by the way, everybody will need a nurse, who haven't even seen a nurse, are affected by how well the nurse is because of how that nurse affects other people. And it's not just frontline nurses. Sometimes when we talk about all of these effects, we forget that nurse managers and nurse leaders are just as essential and just as bad about taking care of themselves. So I have this philosophy that everything you do should be done in balance. And one of the things that happens in hospitals is when we make decisions, we sometimes forget that. And what I mean by that is every single decision that an organization makes, every decision, should consider concern and love for a variety of stakeholders equally. Doesn't mean the decisions that are made will always seem equal, because sometimes when you do something for one group, it doesn't seem that way to others, but they should all be considered. Now, why am I bringing that up? Well, because the groups that we should be considering are the organization itself, because you have to have a healthy organization that's doing well for a job, right? The employees, everybody who works there, not just nurses, but the entire team need to be considered, because how the nurses are affects the rest of the team. The customers, of course, and usually we put them first, but I'm just putting them in the midst, right? Because it's a balance. We have to be sure that we are loving and taking care of and doing what's right for the customers. The communities, because nurses are of and in the community. And so it's important that we are looking at the health of that. And then finally, the one that most people forget, ourselves. And so you have to balance all of that together when you make decisions. So this last one about balancing for yourself is not selfish. It affects every one of those other stakeholders. And that the effects of what's happening if you don't take care of yourself is we won't be able to take care of any of those other things that are so important. And it's difficult when we have these conversations just talking about one thing, the wellness, and I know Arianna is going to agree with me on this. I just know you are. It's difficult just to talk about one because we are so interconnected. And if we cannot keep all of those things healthy, including ourselves and including the rest of the nurses that we work with and the rest of the teams that we work with, we cannot make the big difference that nurses make in the world. So, just to talk about the effects, organizations are doing things about that, and I don't want to steal any thunder if you're going to ask about this later, but I just want to mention some that organizations should be doing too. I don't want people to think that it's all on me as the nurse to take care of myself. I believe organizations owe it to the people who work for them, just as they owe it to consider those people when they make decisions. They owe it to the people who work for them to make an environment where people want to work and where people can get help if they need it. So did I answer what you were asking?
I think so. Well, that's interesting. That last point you mentioned, and
Uh-huh.
Arianna, one of the things I love about Thrive Global is actually you talk about wellness at an organizational level, not just always the individual, you know, and it's a productivity thing as well. It's good for the organization. So is there anything you'd like to sort of add there, Arianna, about the wellness of the person equating to the wellness of the organization and vice versa?
Absolutely. I think that's one of the most important shifts since the pandemic, that CEOs now have become personally engaged in well-being tools and services offered to their employees. This is no longer the province of just the HR department. And that's because we've seen so clearly the connection between well-being of employees and business metrics like productivity, as you mentioned, Andrew, like retention, attrition, healthcare costs. And one of the things that's so exciting about nurses is that once nurses start practicing take care of themselves, and once the organization supports that, again, for me, it's like through these micro steps and storytelling being embedded in the workflow. And storytelling is very important because if leaders like Kathy write about what they are doing to take care of themselves, then others have cultural permission to do so. Because we're still dealing with a profession where people who are very altruistic are drawn to, and we need to break that idea that being altruistic means that you don't have the luxury to take care of yourself. And that, I think, shift is more likely to happen fast if we have leaders and peers share their stories of what they're doing. And again, it doesn't have to be big. It can be anything that improves how we sleep, what we eat, how much we move, the thoughts we hold in our head. At Thrive, as you know, Andrew, we have 6 journeys, and they're broken down into hundreds of micro steps and storytelling, and then beginning to adopt these healthier behaviors step by step, including something we call habit stacking. Like if you're doing, because the main thing I'm sure Kathy, nurses will say is, I don't have the time. That's why we don't even say take 10 minutes to meditate. We say take 60 seconds in the morning before you go to your phone to set your intention for the day, to remember what you're grateful for. And then you can add time. But I think often, because we are so crushed for time, we think we can't do anything. That's why breaking it down into these micro steps means we can start somewhere and then begin to see the impact this has on ourselves and on our work.
That's an interesting way to look at it, because you know it can be quite overwhelming, can't it? The concept of I've got to take care of myself as well as take care of other people. So the idea you can just do it, it's a bit like losing weight in a sense. Don't try and think about it losing 50 pounds. Think about losing 1 pound a week, and it's slightly easier to achieve than the bigger picture. Yeah, absolutely. So with the idea of humanizing it with leadership, which I think is really important. So for you, Kathy, you've been working in healthcare now pretty much your whole career in very different environments, from a nurse, more hospital-based environment to a military environment, which I know you've also worked in. For you, what have been some of the things you've learned along the way to look after yourself, that you could advise others to do? Just anything big or small?
Okay. Well, I've learned that and I'm going to say about myself, but I've also learned that what's good for me might not be good for you. And that every single individual has to look at that and figure out what works best for them. Because some people might say I'm a workaholic, but it's been good for me, the way that I work, right? But it might not be good for someone else. And one reason and so that's one thing that I've learned, is that for me to say, well, you should do this, is not right. It's not right to give the advice to someone. It's good to offer all the different things that people could do. And I love what Arianna said about breaking it down into small bits of times, because you're absolutely right. I myself have learned over time that because I had, and this is a strange story, and you may not think it has to do with health, but it does. when I was a brand new little first lieutenant in the Army, I suddenly had a nursing unit that I was in charge of. And the biggest mistake that I made was it was so important to me to be liked. I thought that was the healthy, that would make me feel good, make me feel healthier. It was so important for me to be liked that I didn't deal with issues and problems, and I did other people's jobs as well as my own. And so one day I woke up and I saw that there were people who were sitting having coffee breaks when I was running 10 hours a day, not getting it done. And I realized that for my own health and for the good of the unit, I had to learn to deal with talking with people about them doing their jobs and working together as a team. Now, that may not sound like healthy, but it is. And it's an issue for nurses too. I see that for some nurses that we have a need sometimes to be the one who stays and does the work. We have the need to be, and we think that, but really and truly, that's not always the right thing for everyone. So that's one story for me about what I learned about my own health and my own mental well-being as well as my physical health.
I mean, for me personally, I've always remembered one thing that I got told a long time ago: you can't control what you can't control,
Right.
so don't worry about it.
That's a wonderful one. That's it.
I kind of live by that myself now. And Arianna, what about yourself? What, in your very successful career in the corporate world, what have you used yourself to deal with pressure, deal with stress that you could talk about?
Well, I started practicing these wellness micro steps after I collapsed from burnout and hit my head on my desk and broke my cheekbone. And that was really the beginning of my understanding how delusional I was, thinking that in order to be a super founder, I was building the Huffington Post at the time, and a super mom, I didn't have the luxury to take care of myself. And I saw how idiotic that was. And for me, my priority was sleep. And in fact, I wrote a whole book on sleep. I'm focusing on the science of sleep, which is really incontrovertible. Now we know that it's so essential for our immunity as well as our mental health. And so that was like what they call my keystone habit. Once I started changing my practice around sleep and getting enough sleep, everything else became easier around food and exercise. And so everybody has to find their own keystone habit. For someone else, it may be what they eat or how much they move. But definitely, as Kathy said, everything is interconnected. And once we begin to adopt healthier habits in one area, it's easier to adopt them in the other areas. And just one other thing that I'm really excited about bringing these practices to nurses is because if they really believe in this and practice them, they're going to be able to help so many of the people they interact with just by giving them that advice. Because I feel that generally in healthcare, we need to go upstream and address problems before they become diseases. Because right now, we know that if you include mental health, 90% of our healthcare problems and healthcare costs can be impacted if we change daily behaviors, 90%. And yet 97% of investment is at the last mile of healthcare, once people are really sick. But there's so much we can do in advance to prevent people from being diabetic, or even to reverse diabetes or high blood pressure, or a lot of things that, if left unaddressed, become major health issues. Yeah. And I believe profoundly that if nurses begin to take care of themselves along all these issues, they will be able to communicate all that to the patients they care for.
Yeah, and it's funny you say that, Arianna, because we've got enough time just for a question, but it's actually a question that's been asked a few times here. And it really, to you, Kathy, this question's come up a few times, as I say. It's really the real world, if you like. How do I tell my supervisor? How do I tell the leader of my department that I think I'm having problems? I'm having mental health issues. I feel burnt out. How do you feel is the best way they can approach their leader or their supervisor, etc., and actually communicate how they're feeling?
Well, I'm hoping that you have the type of leaders that you feel safe doing that, because that's part of our job in leadership. At Common Spirit Health, just to give some examples, we're doing a lot of different things about mind-body relationship, the relationship between what you're thinking and your body and your health. And we also have a whole list of programs that we offer, because we know that different nurses will need different things. But I don't think you're in the right place if you can't say that. I'm sorry, but you're not. You need to be able to go to your manager and say, I'm having this, and tell me what you could do. I'm asking for your help, because as nurses, we should certainly be willing to help each other, and managers should be willing to help just as much as other nurses. And we should be brave enough and courageous enough to say we need help, because that's another issue we haven't really talked about here, to say we need help. And just go and say it. Say, this is what's happening. This is how much I'm working. Can you help me? And if you yourself have an idea, like, I think I would do well if I could have some time, or I think I would do well if I could have this class, or I think I would do well, right? If you have ideas, but even if you don't, it just needs to be direct. Just like you would want your patient to tell you if they needed help from you. Now, you're not a patient, but you are a human, just like your patients are. And it should be okay to go and say to your leader, I'm at this point, help me figure out what I could do to find more joy in work, what I could do to feel better, what I could do if you're feeling like you're having a mental health issue, right? What I could do to get help. Because everybody, I can't believe there's a system out there that doesn't have EAP programs, that don't have a long list of things that they do for their staff, especially these days. And you deserve a manager who's going to give you sympathy and empathy and help you figure out how to help yourself when you have the courage to go and say that you need it.
Well, speaking to you both today, it's kind of uncanny how on the same page you both are. And this has probably been the quickest half hour I've ever spent. But just to say thank you to you both for joining us today. Thrive Global doing incredible work in the space, and I'd welcome everyone to go and look at them. Common Spirit Health, you're the largest system in the United States, supporting nurses as always, with Kathy, and just announced the largest nurse residency program in the country, I believe, Kathy, which is a great way to support new nurses in particular.
Thank you
for all of us at DHGE, thank you for your time today. And you'll be able to watch this webinar again online. But thank you very much from us all. Take care.
Thank you. Thank you so much.
Thank you.